Hi, I'm Annie Clark. Welcome to week 9 of Exercise for Depression. For the past 8 weeks, I've been talking about how depression affects a person's life and how exercise can be good to help with their symptoms. So this week, what I wanted to talk about is people with bipolar disorder, because depression is part of bipolar disorder and exercise can help with that, as well as the periods of mania. So when somebody has bipolar disorder, they cycle between feeling depressed and feeling hypomanic. And when they're hypomanic, they can do things like excessively spend, gamble, invest in crazy investments. So typically, the treatment for bipolar disorder has been medications, which include antipsychotics, medication for epilepsy, and mood stabilizers such as Epilem and lithium. Research has also found that people who suffer from bipolar disorder can also benefit from cognitive behavioral therapy. So it follows that they would also benefit from exercise. There are 4 reasons to believe that exercise can be beneficial for patients with bipolar disorder. Firstly, there is evidence that programmed exercise can reduce stress and anxiety. Secondly, exercise can stabilize the sleep-wake cycle and help the person get more sleep. Thirdly, interventions for bipolar disorder frequently involve programs to structure sleep, wake, and activity cycles more generally, and exercise can play an important role in the activity part of that. And fourthly, periods of irritability and anger are also characterized by bipolar disorder, and studies have shown that exercise can reduce anger and distrust in patients with bipolar disorder. It can calm feelings of irritability and anger. So there are the 4 main reasons why exercise is really good for patients with bipolar disorder. It also has an added bonus of helping with weight loss, because often the medication that patients go on for bipolar disorder can cause weight gain. So the exercise can help control their weight and reduce any weight gain that they have due to the medications. As far as how to use exercise for bipolar disorder, it's the same as what I've been talking about for the last 8 weeks for the treatment of depression. So basically, try and exercise 3 to 5 days a week, minimum of 30 minutes a time, and it can be mild, moderate, or high intensity exercise, such as running, walking, swimming. Ideally include some weight training in there. And you should find that with the exercise and the medication, and ideally some cognitive behavioral therapy as well, that if you have bipolar disorder, that the exercise, along with those other 2 initiatives, will really help control your mood. It will help lift your mood in the down phase and control your mood and help you remain more calm in the manic phase. So see how you go, get some exercise in, post your exercise to social media with the hashtag exercise for depression with a 4 in the middle, to let me know how you're going and also encourage other people to exercise. And I'll see you next week for week 10, which is the last week. So have a great week.